Lamar Alexander, as you know, yesterday said that the Senate bill on health care reform was a turkey, and the turkey's not going to taste any better in November. What is, to mix our proteins, what's your biggest beef about the current health care bills on Capitol Hill? And we don't want to get into too much detail, but what's wrong with it in your view?
Well, one of the things...
Because most people do want a public option, Governor, as you know.
Well, I'm not sure...
At least according to polls.
Some polls indicate that, but I don't know that people fully understand what a public option means. It does mean that over time, people will be forced into that option because private insurance can't compete if they're trying to compete with an entity that is being highly subsidized. There's several problems, and I'll try to get to some of the big ones quickly.
Why can't private insurance companies compete by maybe lowering their prices so they can be more competitive?
You know, it's interesting because private insurances are less likely to deny coverage than Medicare. Medicare, the government-run option, has twice as many denial of claims as does the next private insurance company. I'm not defending insurance companies because sometimes they do some really heartless things. I mean, they can be cruel. And I've experienced it firsthand, so I'm not out there saying, oh, they're wonderful and they're just all about being compassionate. But the government is not exactly getting A pluses for their administration of health care. I thought that it was outrageous when this government panel this week came out and suggested that women not get the mammograms every year. That could result in a lot of women dying. But specifically back to the health bill in the Senate. First of all, you're paying for something for 3 years before you get the benefits. It's the equivalent of paying rent on a house for 3 years before they let you move in. That's the way that they game this whole plan into making it appear that it's paying for itself. It isn't. They claim that there's going to be these enormous savings in Medicare. There's only one way that you can really create savings when you have a baby boom population, that 10,000 baby boomers a day are retiring. You're moving more people into that population, and it's going to cost less even when medical costs go up. I mean, that's not good government. That's magic. And that's not going to happen. We need to quit kidding ourselves. I think that this is an attempt to have a political bill rather than something that attacks the fundamental problem in America, which is not health care, it's health. Because 80% of the cost that we spend, $2.4 trillion on health care, it's chronic disease. Chronic disease is driving the healthcare cost in this country, and that's primarily overeating, underexercising, and smoking. If we're really serious about bringing costs down, you got to bring the quality of life, the health of the Americans up.